So right now, most women and doctors believe that menopause is inevitable. And that's why this is so controversial, because the majority of people believe that this is true. And this is why I feel this work is so important, that we talk about, well, gosh, women really can control whether they experience menopause or even perimenopause at all. So when I realize it's not inevitable and that women have a choice, I wanted to bring this to the forefront. Hello, everyone. You're listening to the MeNoPause Moxie podcast, where we strategically challenge the status quo on perimenopause, menopause, and female hormone balancing. I'm Marie Hoig, and I'm here with my co-host and producer, Maggie Kuhn. Welcome to the show. For decades, women have been told menopause is inevitable. But what if the truth is that women are suffering needlessly because the medical system is designed to keep them in a state of hormone deficiency and profit from it? This should anger you. It did me. Hello, Maggie. How are you?
Hey, Marie. This is going to be a really good episode today. Certainly, when I found out that I was being way underdosed, I was so angry because it had stolen years of my life, I felt. So I think our listeners are really going to get some valuable information from our episode today. I'm really glad we're talking about this. So let's just jump right in. The concept of menopause prevention is pretty edgy. Remind our audience how you came to this discovery, to this understanding that menopause is preventable.
It really was more of an epiphany and a realization. I really remember a very specific time and place where I was standing and thinking, coming to the realization that women can restore and maintain a healthy menstrual cycle for as long as they want. I was doing it myself. I had reversed my menopause, and I was watching patient after patient after patient restore a healthy menstrual cycle. And as the years went by, as I noticed that this was a thing, I started to figure out, well, why aren't we doing this for everybody? Because it isn't about preventing menopause as it is restoring a healthy menstrual cycle and the benefits that come from maintaining a healthy menstrual cycle. So when I realized that the longer women can maintain a healthy menstrual cycle, the better they feel, and there are no real side effects to it other than that menstrual cycle, it really opened my eyes to what we've been told as, that women have to go through this, when in reality they don't. Women don't have to live their lives miserably. And I was very curious, how long can this last? So as the years went by, I saw that women just felt good and felt better, and it was consistent year after year after year. I was waiting for it to not be good any longer, waiting for negative clinical indicators to appear. But the reality was, women just felt better the longer they were able to maintain a menstrual cycle. And so this was really the discovery for me as a patient, but also as a clinical hormone coach, what was going on with our patient base.
Hmm. Well, we're going to get into everything you've just touched on in this episode. But right now, I just want to sort of take us back a little bit and level set. So, what is the traditional narrative that women have been given?
Well, it's all over the place. Menopause is inevitable. Every woman is going to experience it. It's just something that's a part of life. And not only do women experience it, but everybody else in their life experiences the side effects of their loved one going through menopause. So right now, most women and doctors believe that menopause is inevitable. And that's why this is so controversial, because the majority of people believe that this is true. And this is why I feel this work is so important, that we talk about, well, gosh, women really can control whether they experience menopause or even perimenopause at all. So when I realize it's not inevitable and that women have a choice, uh, you know, I, I I wanted to bring this to the forefront. So women have been conditioned that hot flashes are inevitable, that brain fog is inevitable, that all these miserable symptoms are what women have to live with. So right now, women think, okay, well, I'm going through menopause. I have to live through these things, and I'll get on some low dose hormone therapy, and I'll manage my symptoms, my mental illness symptoms and physical deterioration symptoms with drugs, with supplements, with low dose hormone therapy, and that this is the way life is. And so for me, I really thought when I saw my mother go through her menopause after her hysterectomy, it completely changed the dynamic of our family. I mean, we had a different mother after that point. And I never wanted to go through that. I didn't know a lot about it at the time, but I know I didn't want to go through it. But I didn't know anything about it for many, many years until we stumbled upon it.
Who benefits keeping women and doctors in the dark?
If you prevent menopause, what you're really preventing is the side effects of hormone deficiency, which there are, I want to say, thousands of side effects to hormone deficiency. And so the first thing that comes to mind for me is pharmaceutical companies. The pharmaceutical industry is really who benefits from keeping women feeling miserable mentally and physically. Because what I've noticed clinically, that when women get enough of the right hormones, their brains and bodies don't fall apart. If women can maintain estrogen and progesterone in certain levels, they don't have mental illnesses that most women have remaining hormonally deficient. So then I have to say, oh, well, who's benefiting from this? Where is all the data that shows this? We should have this information in the National Library of Medicine. But when I realized that this was actually a thing, my first inclination was, oh, let's see some studies on this. Clearly, there has to be studies, surely. I mean, really. But what I noticed, there were no studies on this. Well, there were years ago, but they've been pulled out of the National Library of Medicine. And that's what really got me curious. Or who's benefiting from this? If we can stumble upon this clinically, why isn't there an abundant amount of studies that talk about this? It's like it's not that difficult once you figure it out. And so then it's like, okay, who benefits from this? Who benefits keeping me miserable? Because when I don't have enough estrogen or progesterone, I do have mental illness, severe mental illnesses, bipolar disorder, depression, PMDD. I mean, I mentioned in other shows, I mean, it's just my mental illness diagnoses are through the roof. So that means that I'm not on psychotropic drugs. I'm not an eligible candidate for electric shock therapy. I'm not a candidate for years and years and years of talk therapy that never really seemed to get to the root of the depression, but really to manage my life at that time.
Yeah,
But
you're
no,
saying that when you're on and you have plenty of hormones, you're not a candidate for these things because you don't need it.
no, no, and patients stop asking for things. And pretty soon when women don't have depression any longer, they start questioning, do I need to be on this medication?
Yeah.
When their blood pressure, when they're feeling better, they start to question, well, do I need this blood pressure medication? And then when we phase them off and we see that it doesn't come back, so these are, yeah. So the biggest benefactor really of keeping women and doctors in the dark is the pharmaceutical industry.
Yeah. I mean, this is such a mind-bending, mind shift topic that we're going to keep kind of chunking away at this through this episode because it really is blowing the roof off of everything that we've been told and taught. So, what are women currently doing about menopause? What's the current approach? Like what's being provided? What are women asking for? What's happening right now that might sound familiar to our listeners?
Well, since the concept is the brainwashing, I'd have to say, is that menopause is inevitable. Well, women are trying to find doctors and professionals to help them manage their menopause. So usually the first thing women do is they jump on social media and start joining groups about menopause to see what other women are experiencing. Oh, okay, well, I'm not crazy. Well, I am crazy, but there's a reason I'm going through menopause. That's why I'm crazy. And everybody else is having the same problems. And then they further dig around into, well, what are they doing about it? And so women are now going on social media, getting ideas about what to do to manage the symptoms of their hormone deficiencies.
Yeah, women seem to be, and I've done this too, crowdsourcing their medical care
biohacking. Let me biohack my menopause. It's a big term. And, it's really the symptoms management approach. And then they discover these celebrity physicians and these menopause influencers who are really making a big buck off of women suffering because their approach is to keep hormones low, keep women in a state of deficiency, and then make money in other ways. But these influencers really put together some great social media content. They're dancing around on TikTok, and they're, kind of talking about their daily lives, and really relating to these women and saying very powerful things like, I get you, girl. I get, how you feel. And I'm a doctor and I can prescribe hormones, and see, I'm just as miserable as you. In fact, I've never known one of these doctors to get on their social media reel saying, yeah, I'm hormonally balanced. None of these doctors can even tell you what hormonal balance means. So women are going to these influencers, and they go to use their protocols and realize that this is just an exercise wheel of symptoms management. And when women are, finished trying to figure out whether this is good for them or not through this social media influencers, then they go to a doctor that specializes in hormone therapy or menopause. So these menopause specialty doctors, what's a good menopause doctor to go to? Where's their training from? They look at all these things. And so they say, oh, well, you're a certified menopause practitioner. Okay, I'll go to this doctor. And women will
You're
eventually,
laughing. Why are you laughing about that?
well, because that's probably the worst doctor to go to, is a menopause certified doctor, because these doctors are trained to keep women in a state of menopause all the time, because their business model is use low dose therapies, which they call standard of care, low dose therapies that keep women hormonally deficient. So they're still symptomatic. And now the doctor's writing prescriptions for medications to manage the symptoms that otherwise wouldn't exist if the doctor learned a more advanced protocol that actually pulled a woman out of a state of deficiency instead of keeping them in this state. A lot of primary care physicians don't have training outside of med school. Well, number one, there's no HRT training in med school. And if a doctor does get this education, then they usually either read the package insert of the hormones, or they go to a weekend retreat or a weekend conference, or even sign up for a fellowship in anti-aging medicine and learn how to do HRT. Again, but most of these institutions are on low dose therapies. And then women think, oh, well, maybe I'll go to a gynecologist or an endocrinologist. And that's also in that place of a menopause specialist, where these practitioners, I say, have about 4 more years of brainwashing against estrogen. They're almost the worst people to go to. And I know this will make people unhappy, but usually gynecologists and endocrinologists, except for a very small segment of doctors who think outside of the box of conventional standard of care medicine, they believe that estrogen causes cancer. And usually these practitioners are the ones prescribing other hormones other than estrogen to manage the symptoms of estrogen deficiency, because they fear estrogen so much. They're under the impression estrogen causes cancer. So they either talk the patient off of taking hormones or getting off of estrogen, or they keep the dose low. And I don't know how many times that you and I have both heard women say, well, my doctor doesn't want me on estrogen. They think it's going to cause cancer. And so they try to talk women off. And I've been a victim of this, where because of my doctor's fear against estrogen, they've talked me off of estrogen. Just really, they're just fear. I mean, I've had doctors with tears in their eyes saying, please get off of estrogen. You're going to cause cancer. And I've asked these doctors, but you're not educated on it. I mean, what education do you have? You've never even prescribed it at protective doses. You prescribe it at unprotective doses. You've never prescribed it at therapeutic dosing that actually protects my body against cancer. So you don't really know. And then this is it's a frustration that women have, because they think they're going to the best of the best. I mean, who else to go to for hormone therapy but a gynecologist or an endocrinologist?
Yeah, I've been through that as well, and thought that I was taking all the right steps, and on HRT and protecting my bones and my brain and heart, only to come to find out that I was on a low dose therapy that barely was eking out any kind of levels of estrogen.
Ju-
So no protective benefit, and
Mm-mm.
lots of side effects of anxiety and body pains, sleeplessness, all the stuff. And so,
See, we look at those as negative clinical indicators of hormone deficiency. So to us, if doing therapeutic dose protocols, those are symptoms that a patient doesn't have enough estrogen. And so we give women enough estrogen so those things don't happen any longer. And so when a doctor doesn't understand this, then they'll always keep the patient in a state of deficiency and then manage those symptoms with drugs. Or if they're a functional medicine doctor, they'll make bank off of selling hundreds of dollars a month in supplements to manage the side effects of hormone deficiencies that otherwise wouldn't exist if hormones were fully restored.
yeah.
Then after a woman goes to these specialists and they realize nobody really knows what they're doing. And then so now the woman is trying to, okay, well, I think I have enough information here. I've heard enough that I need more estrogen. How am I going to get it? So they start to find ways of accessing estrogen and they try to balance their own hormones. And this is just, can I say, a shit show? I don't know if that's allowed, but
I don't
that's
think
really
there's
what
any FCC regulation on
I
us.
don't know. It might beat me out, but that's what happens is women are so desperate because they know when they increase their estrogen, they feel better, but it's short-lived because they don't really know how to do it. And they start to feel cruddy again and they think they need more. And they're just adjusting left and right and changing dosages and changing protocols. And they're never really giving the right protocol a chance. Because as you've come to know, as I've come to know, getting hormones fully restored, there is a technique and a process. And it is a titration adaptation event that takes place over time as the body adapts to it. It's not a quick fix, but there is a technique and a process. So women really, they're suffering because they're not getting any answers. They can't do it on their own. They can't find a doctor who knows what they're doing. So women are really now just grabbing at straws at how am I going to feel good? How am I going to get my life back? I'm about ready to get fired from my job. My husband wants to divorce me. My kids don't want to talk to me because I'm just absolutely irrational to be around. And they don't blame everybody for wanting to leave them because they understand how bad it is to live with them.
Yeah. I mean, it's really, you're really painting a realistic picture, one that I think a lot of our audiences can probably relate to. And wow, what a mess.
And then the
Really.
women get on this bandwagon. They think it's a big joke and they join the sisterhood of misery, the sisterhood of suffering, of now let's all just make fun of it and come together and suffer together. And then that's where you get the whole we do not care movement. But that's a sad thing to not care. And there's a lot of people that pay the price for mama not caring. And that's just too bad that that's where women end up, is on this bandwagon. And that's the end of the road for a lot of women. It's like, okay, I'll join the sisterhood movement of we do not care because I do not care. And as long as I do not care, then nobody will require anything out of me. They won't require me to love. They won't require me to connect. They won't require me to get my job done. They won't require me to stand up and be a partner in this marriage or this relationship. So leave me alone. Let me be in my misery. I will eat my foods to calm my brain temporarily, which will end up making me more miserable and suppress my hormones even further. And so really nobody benefits, like nobody, not the woman, not the employer, not the family, nobody benefits, but the pharmaceutical industry benefits from this and people selling products to manage the symptoms of the sisterhood of misery.
Hmm.
And that's why I get really irritated at these menopause influencers. They're not really offering solutions.
Let's talk about the truth about menopause. What you have come to learn is the truth, which is this paradigm shift that we're presenting to our audience to consider. Tell us more about what the actual truth of menopause is.
When I train a physician how to prescribe hormone replacement therapy, the most important thing that we begin with is understanding, what are we trying to do? What's the bigger picture? How do we look at this? Because this kind of medicine is different. It's not just about, following the standard of care, prescribing of symptoms management of psychotropic drugs. I mean, really, the doctor has to understand that the side effects, the symptoms that women are experiencing are the side effects of, well, hypoestrogenism, estrogen deficiency. So if we look at menopause as just a state of an extreme state of estrogen deficiency. So now then the practitioner is, hey, well, if I restore hormones and pull the patient out of a state of deficiency, well, then they quickly realize there's no symptoms of deficiency if there's a full restoration. So now there's no symptoms to manage. And this is why it's really important to understand that menopause is just an extreme state of hormone deficiency. But that's good news, because you can do something about the deficiency. You can't do anything about wallowing in the state of menopause. So you have to really look at menopause as really as a state of hormone deficiency. But a lot of people argue with that. I've noticed that, we can't treat menopause as a deficiency state. When I heard that in one of the conferences I went to, I asked, why not? Well, estrogen, and then the mindset is still, even though we're lifting that estrogen causes cancer mindset, it's going to take a couple generations to really fix that. But it's that estrogen causes cancer, we can't prescribe estrogen because we don't want to give our patients cancer. Well, I mean, as you know, Maggie, I've been doing this for, a couple of decades, working with only therapeutic dose protocols. And if estrogen caused cancer, we would see a high rate of cancer. So we have to change the way that we look at menopause and actually prevent not only menopause, but the other conditions that women are sitting ducks for, such as cancer, the brain deteriorating, the heart failing, the lungs deteriorating. I mean, everything about the female body deteriorates when estrogen gets too low.
Bones as well.
Yeah, and bones as well. Estrogen is the number one protectant against disease in women. It is the number one anti-inflammatory agent, which is at the root cause of a lot of disease, stress and inflammation. And estrogen reduces both significantly. So again, it's like, if we know that estrogen is the number one anti-inflammatory agent a woman has and the number one cancer protector and cardioprotective and neuroprotector, why aren't we giving this to women? And why aren't we figuring out how much they need to act so it acts as a protective agent? The reality is that the symptoms of menopause are not the symptoms of menopause. They are the symptoms of hormone deficiency. And if we look at it that way, then we can do something about it, especially when we notice that we're losing our estrogen in stage 1 perimenopause. And once women realize that this is the beginning of the end, women should know that they can prevent menopause the sooner they recognize this than later.
So in your experience, what is the problem with the current approaches?
Well, the current approaches are keeping the woman hormonally deficient. That's the big moneymaker. I mean, even functional medicine doctors are failing women in this regard. I mean, functional medicine, as you know, is an approach to medicine that's designed to get to the root cause of the problem. But functional medicine really fails women in that they use low dose therapies, but they make bank selling hundreds of dollars a month managing the symptoms of hormone deficiency. I loved functional medicine when I was learning about it. I thought it was the greatest thing in the world and thought, why aren't they teaching this in med school? Getting down to the root cause and addressing these conditions as naturally as possible. There's nothing more natural for women than to restore her estrogen and her progesterone levels that mimic a woman in her reproductive prime, so her brain and body don't fall apart like an old woman. So yeah, the current approach is let's keep hormones low. So that's the standard of care. And that's based off of estrogen causes cancer. But now my questions are, when I go to the conferences, are, well, if we're not afraid of estrogen now, and we were prescribing low doses, the standard of care is low dose, then what dose does a woman need to be on? How much can we give estrogen to women? because women, when they're on low dose therapies, they ask for more. And the doctors who aren't educated will say, I can't give you more.
Yeah,
So
I mean it's a vicious cycle here that we're kind of caught in as a society right now. We know a bit about the fact that this is hormone deficiency. That seems to be coming to light more. And if listeners go back and listen to our episode 6 about the 4 generations of HRT, this will help them also put this conversation into context. You know, could you just talk a little bit more about the idea of therapeutic dosing so our audience can understand what it is you're getting at here?
yeah, that episode 6 is such a critical episode because it does we break down the 4 generations of HRT and what you can expect out of each one of those protocols, each one of those approaches. Low dose HRT is what most women get. And the biggest difference is in therapeutic dosing, women get enough of the right hormones, so much so that the brain calms down, the body rebuilds, the body heals from the inside out. The hormone deficiency induced mental illnesses go away, or are significantly reduced. So therapeutic dose is designed to fill a woman's hormone tank completely. And the standard of care dose, the low dose therapies, are designed to only fill the hormone tank partially, maybe a quarter of a tank or maybe a half a tank. So a woman is getting some, so she feels better in the beginning, but it's short lived. If a woman is on a therapeutic dose protocol, it's enough. The brain is getting enough. The body is getting enough for the healing and the repairing, so that each month that she's on a therapeutic dose protocol, she feels better than the month before. And then the third month, she feels better than month 2 and 3. In month 4, she feels better than the previous months. And it goes on and on and on like that for about 12 to 24 months, just depending on the patient. And so this is why you can't just make a quick tweak and think you're going to get a result. And the longer women are on the therapeutic dose, the more healing takes place to the brain and body. And when women stay on these low dose therapies, it impacts a woman's life all over the place, from her ability to do her job, from her ability to be a good wife or a partner, to be a good mother. So this impacts relationships significantly. It also takes such an emotional toll on women because they can't control their behaviors. They have a hard time controlling that bitterness and anger that can come out of their mouth when she talks about how much she hates the world and hates everybody and nothing makes her happy. I hated being in a place in my life where I knew nothing's making me happy. And then, I mean, I remember one day I was sitting in my office when I got on the therapeutic dosing and I thought, I'm happy. There was just a level of contentment and peace where I liked my life. I liked my children. I liked my relationship. I liked my job. I liked my car. Not that I was settling for not having more, but I just didn't feel like I needed it to be happy.
Mhm.
And I realized oh, yeah. And I was looking forward to picking up my kids from school and knowing that I wanted to be around them and them wanted to be around me because of my moods and how stable I was emotionally. Estrogen is the mood stabilizing hormone for women, hands down.
Women, I think a lot of women feel broken or like something has faded, their mojo is kind of gone. And that's, you know, and that's just what they're going to have to live with now. And that's part of this narrative that we've been told, right? And then they might, you know, maybe they do get on HRT, but it's low dose and they get a moment and they feel better and they're like, "Oh my gosh, you know, things are looking up." And then it drops off because it stops working. And because the doctors don't know what to do, I think women end up blaming themselves. And
Well, the doctors gaslight them too,
okay,
Yeah, well, I don't know what your problem is. I have all these patients on hormone therapy, but what they're not saying is, I have no education in this. I have no training. I have no idea where your lab should be. I don't know what to do for you when you tell me that you feel this way still because you're on the highest dose. I do not. Doctors don't say this, and I think this should be malpractice. Doctors should not prescribe hormones or practice a field of medicine in which they haven't been trained. And estrogen is the most powerful agent a woman has from head to toe. And I don't think doctors should be prescribing it without training and without education. It's women are suffering. Their families are suffering. Yeah, women can get very suicidal without estrogen. The lower estrogen gets, the less women want to live. The will to live decreases and decreases and decreases the lower estrogen gets. Like you said, when a woman takes a low dose therapy for the first time, she gets a taste of it and her receptors wake up and it's like, oh my gosh, this feels so good. And then she's like, and then it fizzles out and she goes to the doctor, I need more. And then when the doctor maxes out on the low dose patches, and they're like, well, this is all we have for you. Don't know what your problem is. Here, take the psychotropic drug, or I have some supplements I can sell you to manage those symptoms. And then this is what women are getting. And this to me is a real racket. It is a racket when I figured it out, because I figured out this is a real racket. Because we found when we started making the transition to therapeutic dosing, we didn't switch every patient on therapeutic dosing. We just switched the patients we thought would be a good candidate. But then once we saw it was working out well for these patients, then we started to slowly, gradually talk to the patients about, well, there's this protocol that we're doing, and it's designed to give you therapeutic doses. We think that this might help you. And then so as women transitioned over to this, we realized that women didn't need psychotropic drugs. And so we found out that, okay, well, these women, we make more money selling supplements to these women who are hormonally deficient. And that was a business. When I looked at that, I'm like, that's interesting. But these women don't buy the same as much supplements, and we don't prescribe as much medication to manage the symptoms because they just don't exist. And so this was one of the eye-opening things. So this is when I saw, okay, this is a real racket. And then I got very angry with functional medicine. I'm like, y'all are lying. You're telling women you're getting to the root cause, but you're still giving them minuscule amounts of estrogen and still making money off their suffering under the guise of being natural. And that really didn't sit well with me. And we had to, in our clinic, had to say, okay, well, we can't ethically, if we know we can actually get a woman to feel better, we can't continue to keep them hormonally deficient and then make money off their suffering. So that's where it is. So right now, the racket is like a 3-step process. It's underdose hormones for women, so they're still suffering. Then they can prescribe more drugs and sell more supplements, and then repeat. And this is like a rinse and repeat thing. So this is the exercise wheel that women get on, that they're on low dose therapies. They're managing the side effects of hormone deficiencies with drugs and supplements. And women don't realize that they can actually control this. They don't have to stay in this spiraling cesspool of this decline and misery where everybody else is making money off of your suffering. The most empowering thing a woman can do for herself is to take her brain and body back by demanding therapeutic dose protocols. And so it is a profitable loop at women's expense in 5 ways: mentally, physically, emotionally, behaviorally, and especially financially. I know what I say is controversial. I get it. And for many years, I didn't talk about this. But at this point, I don't care. If you don't like what I have to say, don't listen. But if this resonates with women, listeners, and even doctors, if you're a physician listening to this, give me a call. I will teach you how to prescribe therapeutic dose protocols, and you will see for yourself in the clinic. Don't take my word for it. See for yourself. You'll learn that, oh, okay, well, these patients, I have these patients on this protocol, and well, they're not needing these psychotropic drugs. They don't have depression any longer. They don't have anxiety. They have a libido. I ran into a patient this morning at the gym, a local patient, and she was just saying, oh my gosh, I just started my estrogen injections, and I couldn't believe all the stuff I got done. Like, could that be the estrogen? And I'm like, well, yeah. So yeah, we need to look at menopause as something to prevent and look at it as a side effect of hypoestrogenism, because that gives everybody hope. You tell women they're going to be in menopause, it's hopeless. Yeah, well, you're just going to suffer. And then everybody around you is going to suffer. And then they're going to require less out of you. And you will further detach from not only your family, your children, but society as a whole. And I can tell you something, that is a lonely, lonely existence.
Let's talk about the topic of our episode, which is menopause prevention. So this is where the big mind shift comes in. Um, let's start with, why would a woman want to prevent menopause?
Well, again, we have to look at this as why. It should be rephrased as, why would a woman want to restore her hormones, or why would a woman want to stay in a state of hormone deficiency? And it's that simple. And that's really what I want women to ask, is why would I want to remain here? Not why would I want to prevent menopause? Because I think when women talk about menopause, they think of losing the period. Oh, my periods were horrible. Yeah, I can't wait for menopause. It's like, oh no, you don't. Um, it's really the quality of the menstrual cycle. And it's the menstrual cycle that acts as the barometer to a woman's overall health, mental health, and physical health. And this is why we talk about the menstrual cycle as being this barometer, because we'll know how a woman is feeling based off of the quality of her periods, her menstrual cycle. So, and a lot of women go, I don't want to have a menstrual cycle for life. Well, a menstrual cycle, like I said, is that true barometer. And when women's menstrual cycle is healthy, then she doesn't have depression, anxiety. She doesn't have pelvic inflammation, horrible periods, mood swings, PMS, PMDD. If a woman experiences those things, well, chances are she's hormonally deficient because of the side effects of estrogen deficiency. And so restoring and maintaining a healthy menstrual cycle, women notice that, well, they don't have mental illness. They don't have, their bodies aren't physically falling apart. So as long as a woman can maintain a healthy menstrual cycle, whether she has a uterus or not, her brain and body are functioning of where her brain and body believes she is in her reproductive prime. So the body heals and repairs and tries to stay as healthy as possible, as long as the hormone messaging is that this patient is in their reproductive prime. So to prevent menopause means you're preventing hormone deficiency induced mental illness. And that is a thing that we need to talk more about. That probably the majority, about 80 to 85% of the mental illness diagnoses that women get are directly related to estrogen deficiency. And once women realize this and they fully restore their hormones, they will have no problem preventing menopause.
Okay, so you've talked about the mental benefits. Let's hear about some of the physical benefits.
Yeah, the physical benefits is the diseases that actually go away. And I know you can't say that. You can't say in medicine, oh, you're going to be cured, or this is going to fix, or this will take it away. Well, it's good that I'm not a physician, because I can say those things from experience. I no longer have mental illness at all. When I was riddled with about a half a dozen mental illness diagnoses. But also what I was feeling was joint pain. I had fibromyalgia, high blood pressure, high cholesterol. I was pre-diabetic. And bringing estrogen strengthens the heart. It denses up the bones. When the circulating hormone levels that women have, which mimic somebody in their reproductive prime, it signals the brain that the physical body is in their reproductive prime. And if the physical body does not match what the hormone messaging is saying, the body wants to heal and repair itself to mimic a woman in a reproductive prime. So what we see over this transitional process with therapeutic dosing, the body reshapes itself. The boobs come back, they fill out on the upper part, they stop sagging as much as they used to. It just depends on the woman. The body reshapes itself. It wants to give a woman a girlish figure. The fat is redistributed throughout the body, and women start losing unnecessary fat, and women's bodies start to, well, get curves. Some women don't like that. Some women really want to be rail thin with no fat, but really a woman's body is supposed to be voluptuous and curvy and breasty. And so the body tries to replicate that. The fibromyalgia goes away because the body holds on to water. When a woman restores her estrogen, the brain says, oh, I have to be young and vital and healthy to reproduce and take care of my family, my children. So the body holds on to the water and uses that throughout the entire body to rebuild this muscle mass, to strengthen the heart. So the heart gets stronger. And this is one of the ways that This helps with women's hearts because the heart gets stronger. When we lose estrogen, muscles atrophy, and it atrophies because we become dehydrated internally. When you restore the estrogen, you restore body fluid balance. So these organs and these tissues rejuvenate and they want to work the way that they should because the hormone messaging is this woman should be healthy. So joint pain goes away, the heart strengthens, the shortness of breath goes away, heart palpitations go away, depression goes away, energy comes back, and insomnia goes away, the libido comes. I mean, really everything about the body from head to toe, mentally and physically, gets better. We're going to do our series, our clinical indicator series, on each 50 clinical indicators on how estrogen impacts absolutely every single one of these. And then what women can do, not only with hormones, but a combination of things to help combat those things.
Someone listening might think that, and actually, I had a doctor say this to me, you just want to be young forever.
Oh,
yeah, I was like
you say that like it's a bad thing.
Right, exactly. And yeah, very accusatory. And she was trying to get my estrogen down and get me off of estrogen. And I thought, well, that's, of course, I left her as a doctor. But I thought that that was such a funny thing to say. But I'm raising it because it's not as if and we're now embalming ourselves and we will never age. It's that we will have health span while we have our lifespan, meaning we're going to be healthy. We're going to be as pain-free as possible. We're going to have our wits about us. We're not going to have a heart attack. Our bones will stay strong and not break a hip and die. You know, and it's not to live forever. It's just that as long as we are alive, let's be healthy.
And this is why we need more studies on therapeutic dosing and the impact it has on the female body. I mean, we need to demand these studies. And this is where I thought it was just like, this is a real racket because we've stumbled upon therapeutic dosing. When I go to find the research on it, it doesn't exist, or it did once and it was pulled. So why are we keeping everybody in the dark about this? It's not like it's that difficult. And so really women have more control over how their brains and bodies function. But I do want to interject here. The thing I like most about estrogen, there's so many things to love about full hormone restoration, but my favorite is estrogen is the happiness hormone. It is the double down happiness hormone where women just feel happy underneath it all for no real good reason. It's such a coping hormone that I just like, even when things are not going well, it's still underneath it all. I feel like I can handle it. And I'm happy and content with my life. Estrogen allows you to make those connections, those emotional and intellectual connections with people, which I feel is probably the most important thing of life, is these interpersonal connections with people. But you can't have that if you're not happy or feel good.
Well, I think we've talked about before that estrogen deficiency is the leading cause of Karenism.
Karenism, that's a good one. Yeah, really. Karen is the biggest side effect of estrogen deficiency is a bitchy woman. And nobody likes Karens. That's why that's a thing. And it angers me that our society has accepted this as that, well, this is just how women are. No, it is if they're hormonally deficient. And I was really the Karen that everybody describes when I didn't have estrogen. I mean, women can go quick into anger and a rage if they're estrogen deficient. And I don't like the fact that women are being withheld estrogen and made to behave this way. And then we're made fun of and ridiculed because we behave in a way that we only do when we're deprived of estrogen. It's almost like, don't piss in my ear and tell me it's raining. Don't withhold my estrogen and complain because you don't like my behavior.
Yeah.
You can
Again,
tell
this
I
vicious
get
cycle.
heated about that because I don't like that because it is a vicious cycle. It's like, don't make fun of you. Keep my estrogen from me and then you complain because you don't like how I behave.
Yeah. Let's talk about the steps to preventing menopause. What can women do? What are the actual practical steps?
I tell you, the first thing that women really need to do is understand estrogen. Learn all you can about estrogen, how much your brain needs estrogen. Learn that estrogen does not cause cancer, that rather you are a sitting duck for cancer if you remain estrogen deficient. Women have to understand how much estrogen they really need to thrive, because this is the mindset that's going to propel you forward. And menopause prevention really starts when you learn about estrogen. Menopause really starts at pre-puberty. The longer a woman can maintain a healthy menstrual cycle in her life, the better off she'll be. So menopause prevention starts with the diet and the lifestyle of a young woman. And if she can maintain that healthy menstrual cycle for life, she's in a better place. And then really, and that's step one. Step two is to understand the big difference between therapeutic dosed HRT and low dose HRT, because that will determine who you go to prescribe your hormone therapy. If you understand the concept of therapeutic dose protocols, when you go to Google or search for a hormone doctor, you'll know that this doctor understands the difference between filling a woman's hormone tank up partially and full restoration, giving women the right amount of the right hormones so she has enough estrogen. So preventing it by maintaining a healthy menstrual cycle as long as possible and understanding estrogen, understanding therapeutic dose hormone therapy, and finding not just a doctor, but a team, because it takes more than the prescriber to fully restore hormones, which is where I got into clinical hormone coaching. So finding a team of people who are trained in therapeutic dosing and who have clinical experience with getting patients through to the hormone sweet spot, which is the end goal of therapeutic dosing, the end goal of menopause prevention through hormone therapy. And then the fourth is really maintain that hormonal balance for life, because that hormone sweet spot is a place of optimal hormone homeostasis. And that's where we want to keep women forever. So we want to prevent that. Once you get into ultimate, really the true hormonal balance, and the goal is to stay there for life.
So, can all women prevent menopause?
No, not all women are healthy enough. You have to be a relatively healthy woman to get on to use a therapeutic dose protocol. The longer women wait to start hormone therapy, the more tissue damage, the more damage takes place internally. The organs fall apart, they shrivel up, and they start to malfunction. And the longer a woman's heart has been deteriorating, the harder it is to resurrect the heart. The longer a woman has gone without estrogen, those lungs collapse and they start to malfunction, and women can't take a deep breath. So, no, not all women, and women with severe gut dysbiosis. This is why we've categorized patients in the clinic, of which we'll get into in another podcast, on the 5 clinical categories of hormonal women, perimenopausal women. Because not all women have the same response, and it really does depend on their overall health.
What about women who don't have a uterus? Can they prevent menopause?
Yeah, so the menopause and a period are 2 different things. You can still have a menstrual cycle and not have a monthly period bleed. The goal is to restore a menstrual cycle with an advanced hormone replacement therapy system that uses therapeutic dosing, and the hormones are cycled in a way that mimics a woman in her natural reproductive prime. So estrogen is maintained at a certain level most of the time, all the time, and then progesterone is cycled days 14 through 28. This actually regulates the menstrual cycle. Not only the menstrual cycle, but all the other processes in the female body are dependent upon this cycle. And so if a woman doesn't have so the entire body benefits whether a woman has a uterus or not. So this isn't just contingent on the uterus. And these women typically do better. Women without a uterus typically do better, because we're not trying to manage the period itself, because we're really at the mercy at this point of the overall health of the uterus. When we restore hormones, we're depending on the uterus to still be healthy. And then some women will discover that their uterus is not healthy enough. But when we talk about lowering the hormones for a woman who's having menstrual problems with this protocol, they don't want to lower their estrogen. They want to stay on the therapeutic dosing they have. And so they do other things to help manage the health of this uterus. And And then we get into that more personally with each patient on a case-by-case basis. So yeah, you don't have to have a uterus to have a menstrual cycle. The menstrual cycle is that 28-day cycle.
Yeah.
And the period bleed is days 1 through 6, that first week of that.
Are there any downsides to preventing menopause?
Well, having a period. If a woman has a uterus, I mean, when women get into about their late 70s and 80s, they don't want to have a period bleed any longer. And this can be a downside. And the downside is a period bleed. That's pretty much the downside. If it's done correctly, that's probably the biggest drawback is having a regular monthly bleed. But some women are like, hey, if this is all I have to endure is a light to moderate flow, I'm good. But then when women get a little older, they don't want to have that monthly period bleed. And women still age underneath it all. Then for some women, the ovary or the uterus just gets old. And then we have to talk about, okay, do we lower the hormones to stop the bleeding? Or does the patient get a hysterectomy or something else? So then that's a conversation that we have with the patient. But most of the time, when you tell a woman to stop the bleeding, we'll need to lower your estrogen, they gasp. They're like, oh no, I don't want to lower my estrogen, because they know what life is like without it. So then they start to do, and then they usually end up getting a hysterectomy or something. But yeah, the biggest side effect of this menstrual cycle is having to deal. But then some women are so excited, they're in their 60s and 70s, and they're slapping tampons down on the conveyor belt at the supermarket, and they love it. They're like, yes, I'm on my period. These are not my daughters. These are mine. So some women, but it just depends. But we haven't seen an increase of cancer. In fact, what I've seen, because I've been monitoring this for nearly 20 years, that we've seen a reduction of cancer, a reduction of tumors, a reduction of most of the diseases that women are told that they have to get. I mean, this is why I do this, and why I do it so confidently, because when you see this for yourself, there's no doubt.
Well, this is the revolutionary revelation about this, is that contrary to this being some sort of a risk to supplement your hormones, it's the thing that's going to keep you healthy.
Yes, it is. This actually is the most empowering thing a woman has to control. It's like, oh, really? You think you're going to make money off of my suffering? No, I'm going to get myself some estrogen and progesterone and cycle it the way that it should be. So my brain and body are working the way that it should, in a very healthy way. And so it does. The brain and body heal and repair to varying degrees. But the goal is to not wait until you're completely deficient, until the brain and body have deteriorated into disease.
Yeah, you're getting to a next question that I have, which is twofold. How long can a woman prevent menopause? And you were sort of getting to that. And then the second part of that question is when should a woman start thinking about this?
Well, Dr. Robert Wilson in the 50s and 60s was talking about women need estrogen from puberty to the grave. And I wholeheartedly agree. I could never imagine going through my life ever without estrogen. I will die with my estrogen vial in my hand. It is the elixir of life. For me, it's the elixir of happiness. It's just the elixir of stability. We haven't seen any side effects of it. And if we do, it's a case-by-case basis, and it's pretty rare.
So the answer being indefinitely, that someone could.
Forever. I mean, and those are part of the studies that have been pulled out of the National Library of Medicine. I mean, Dr. Robert Wilson wrote a study called The Obsolete Menopause. I mean, he was talking about this in the 50s. He said, hey, well, there's no reason women have to go through this. They started to pull his studies when he was saying, no, we don't have to deal with those things, as they were starting to, like, Premarin and Prempro were coming about on the market. And Dr. Wilson's like, well, hold on a second. That's low dose. If you give women enough, they don't even have to experience menopause at all. And incidentally, I wanted to say about every once in a while, I'll overhear a commercial on, I think it was Premarin. And in the background, I'll hear the announcer say things like, well, don't prescribe Premarin to prevent osteoporosis. Don't prescribe Premarin to prevent cardiovascular disease. Don't prescribe Premarin to prevent neurodegenerative disorders. It's like, Why not? If you already know that it does, why not? I mean, this is a part of, it's like if your whites aren't white, use more bleach. Well, if you use bleach on white, it takes out the coloring of the white and makes it dingy as like cotton. So it's just kind of like this mindset that we've been told that bleach makes our clothes whiter. And if it looks dingy, use more bleach. And so
Yeah.
we've all bought into, well, we're told that Clorox whitens our clothes. We have to keep doing it because our clothes never look white. It's like that, the lie, the perpetuating lie that we buy into. Menopause is inevitable.
Yeah. When should a woman be thinking about this?
The best time for a woman to start therapeutic dose hormone therapy is in stage 1 perimenopause. That is when a woman has decided she's finished bearing children and her menstrual cycles are irregular. That is the telltale sign that this is the beginning of the end and the hormones are in a decline. And if it's not caught at this time, then there will be a slow declining brain and body deterioration. It's like the living decaying process. As estrogen declines, women will feel worse and worse and worse. And the lower estrogen gets, the worse a woman feels until she just kind of really loses her frontal lobe. And that's where she gets Alzheimer's disease, dementia. I mean, the best way to prevent these conditions is to restore estrogen so the brain believes a woman is in her reproductive prime and she needs her wits about her. Preserve that frontal lobe. The best frontal lobe preserving agent is estrogen. So the best time to preserve all this is before all these things fall apart.
Here's another contradiction to that, because a lot of women are told by their doctors that they cannot start HRT until they're in menopause.
My advice to those women, find a doctor who knows exactly what they're doing. Hormone therapy should not be a crapshoot. There are some questions that you need to ask doctors about their education, their training, and their approach. But in order to do that, you have to know about estrogen. You have to know how much you need. Most women know more about hormones than the doctors they go to for their prescriptions. So women need to look for doctors who know what they're doing. And it's extremely difficult to do because everybody's using the same language, even though they don't get the same clinical results. I mean, how many times have you heard a doctor say, oh, well, I'll get your hormones optimal. I'll get your hormones balanced. If your doctor is saying that they balance hormones to optimal levels, ask what those levels are. Is that a range? Because doctors don't really know what that means. And you need to know, if a doctor says, I'll optimize your hormones, okay, what's optimal? Come back with know enough to challenge the doctor. Okay, so you balance, what do you mean by balance my hormones? Is that a clinical destination? Will my labs be at a certain level? Like, how do you know my hormones are balanced? And how long will they be balanced once they're balanced? So this is a show we're doing here in the future on how to find a good HRT doctor.
Yeah.
That's a good reason to subscribe. How to find, and I'll drop you the tips. I'll let you know how to find a good hormone doctor. And at that, I'll have a handout on the questions to ask a hormone doctor before you commit to any sort of treatment.
Let's zoom out right now and talk about why this matters beyond individual women. Why does this whole topic that we're talking about, even this entire podcast, why does this matter?
Well, it matters because when mama ain't happy, ain't nobody happy. I mean, really, if women are feeling miserable all the time, every day, and are just trying to get through the day, that impacts our society as a whole. Women aren't able to work. They're not able to be productive. They're not able to be good mothers. They're not able to be good partners. Everybody is impacted by a woman's hormone levels, good or bad. When women's hormone levels are low, everybody feels that. They hear it, they sense it, they experience it. And they also experience life with a woman with enough hormones. Women with plenty of hormones, they're creative. Their brains are working. They're problem solvers. They're getting stuff done at work. They're getting stuff done at home. They feel good. They feel alive. They're connecting with other people. This impacts, I mean, could you imagine what our world would look like if no woman had to experience perimenopause or menopause at all? like they were just happy for no real good reason every day. What would life be like if women didn't experience menopause? It's just, it's mind blowing. And this is why I do this. It's like, because I truly believe that estrogen can change the world. I think that we can change the world with this. I really do. When women feel good every day for no real good reason, everybody benefits.
Well, that's powerful. So I want to transition now. We're adding a new little segment to our episodes where at the end, we're going to take some of our audience questions, our clinical hormone coaching questions right now. So, Marie, put on your clinical hormone coaching hat. And I'm going to ask you a couple of questions that have come through from some of our audience members. All right, here's the first one. I'm 2 years post-menopause and experiencing sleeplessness, terrible brain fog, intense joint pain, and other symptoms. Could this be my hormones? I'm not on HRT.
Well, I can't say individually, one, because I'm not a doctor and there's been no exam, but I can say that these are very typical symptoms of women experiencing estrogen deficiency. And it's not uncommon that women who are postmenopausal are they're in a state of extreme hormone deficiency. So my first response is, yeah, it's, women who have plenty of estrogen sleep through the night. Their brain is working. They don't experience brain fog. In fact, that's one of the first things that goes away in women from within about an hour of starting therapeutic dose HRT is the fog lifts. Women don't get joint pain within about 2 weeks is kind of the average when it comes to joint pain, where women will not experience joint pain. That's pretty universal. So these, if we look at this as, well, these are symptoms of estrogen deficiency, including being in postmenopause. So to not be on HRT, well, you probably wouldn't have these things if you were on HRT. So I highly recommend to reverse your menopause. In fact, that's a future podcast where we'll talk about how to reverse, if you're already in menopause, how to reverse it. And so listen up for that one or pay attention to that, subscribe so you'll get a notice when we drop that. But yeah, I do believe, and this is why I have women at first, if you're experiencing some of these things, then physically and mentally, fully restore your hormones first. So any estrogen deficiency related condition we can rule out. So if we fully restore the hormones, we'll know what was related to hormone deficiency. And then if there's anything else left, then now that's, to me, that's true functional medicine. Most of the root cause is restoring hormones back to youthful levels. And if the patient still has some of these symptoms, then you go somewhere else to look what else can be contributing to the migraines or the headaches or the insomnia or the joint pain. But most of the time, the joint pain goes away within a couple of weeks.
All right, thank you. All right, here's another one. Can I boost my sex hormones naturally with supplements, diet, and exercise instead of having to put something foreign in my body like estradiol and progesterone?
Yes and no. Okay, so yes, that if a woman's ovaries are healthy enough, and this doesn't have much to do with age, because young women's ovaries, we're finding a lot of them are broken from the get-go. So the answer to them would be no. We used to do an ovarian function analysis protocol where we would test the ovaries out to see if they were healthy enough to produce adequate levels of estrogen and progesterone to restore and maintain a healthy menstrual cycle. And one of the couple of ways that we do that is if the woman is young enough and she should be producing healthy levels of estrogen and progesterone, then we put them on a specific diet and lifestyle. We'll do baseline hormones, put them on a diet and lifestyle program. We retest the hormones in 3.5 to 4 months, and we see if this protocol helped increase because the ovaries were healthy enough. But like I was saying, most young women have been handed down their broken ovaries from their mother, and they've never produced healthy levels of hormones in their life, hence the horrible periods and horrible menstrual cycles. So for those women, we can't do that. In fact, we stopped doing the ovarian function analysis because now it's just a waste of time, because the majority of young women that come see us now in their late 20s, early 30s, who are complaining of perimenopausal symptoms, now we say, okay, well, this are where your hormone levels are. But if they still want to have children, so we don't want to give a woman hormones if they still want to have children. But if they've decided to not have children, then we put them on a therapeutic dose hormone therapy. But there's only so much the ovaries can do naturally. But then there's a point where those ovaries become too unhealthy to produce estrogen and progesterone to restore the healthy menstrual cycle. The other part of this question is that she doesn't want to put something foreign in her body. I get this. However, you have to look at this differently in that your body was endogenously inside of your body producing estrogen and progesterone. What restoring estrogen and progesterone with exogenous hormones, meaning giving it to your body because your body internally can't produce it. So you're just replenishing what your body was naturally producing with bioidentical hormones, where the hormone molecular structure mimics that of a natural, where as if your body were producing it on its own. So cell for cell, it's molecularly correct. Even though there's some synthesizing, there's no real true bioidentical hormone. However, this is what doctors feel comfortable prescribing. When you do this, your brain is under the impression that you're actually producing it on your own. And so if you're taking it at therapeutic doses and then taking it in a physiological manner that mimics your own natural body's physiology with each hormone, then your body thinks that it's doing it on its own. So now a woman is now in control of not only her menstrual cycle, but all the other processes in her body from head to toe, from digestion to the cardiovascular function, to the neurological function, the circadian rhythm. So I wouldn't look at this as a foreign thing, but replenishing what your natural body is no longer able to do.
Thank you. All right, last one. I'm on HRT, but ready to give up. I've been on the E-patch for 3 weeks and oral progesterone and feel worse than I did before. What gives?
So the most important thing to understand is how much estrogen you need. Patch therapy is considered low dose therapy, and you'll learn more about that in our podcast when we talk about the 4 generations of HRT. Patch therapy is considered second generation HRT, and the goal of this HRT system is to keep hormone levels low at all times. When women take patch therapy, even if they're on the highest dose of patch therapy and they take progesterone, especially oral progesterone at higher doses, they will feel worse for a couple of reasons. One, in order for progesterone to work as the secondary complementary supportive calming hormone to estrogen, there has to be plenty of circulating estrogen in the body to allow this to work. If there isn't enough circulating estrogen in the running through the blood, then progesterone won't work well and women will feel worse. Plenty of estrogen is needed first and foremost for any other hormone to work, including thyroid, testosterone, progesterone. All other hormones are dependent upon plenty of circulating estrogen levels. So the first thing I think of when I look at this, okay, you're on the low dose therapy, progesterone won't work right. You'll feel like hell because that's what happens. And one of the ways that women can feel worse when they start hormone therapy that a lot of people really don't understand is women may have been producing higher levels of estrogen before starting hormone therapy. Then if the doctor gives them patch therapy, that dose can be lower than what they were producing before. And so now we've halted her own hormone production, and whatever has been replenished has been less than what they had. So they can feel worse on patch therapy when they get started. But I know that in my experience, no woman feels good on patch therapy and taking progesterone because estrogen, I mean, it may work for a little bit for some, but it doesn't last long. And this is why women don't feel good. Women need plenty of estrogen in their blood in order for estrogen or progesterone to work the way that it's supposed to. And those two hormones should be cycled the way that the female body produces those hormones in a physiological manner. So the brain is under the impression that it's producing these hormones and it sets the tone for all the regulatory systems in the body, including gut health.
All right. Well, thank you. Be sure to send your questions in, and we'll get to several of those at the end of every episode now going forward. Marie, I just want to say thank you for all of your expertise today and introducing this wild topic of menopause prevention. And I think we'll probably be revisiting this in some form or another throughout the rest of our episodes, because this is the core of what you advocate for. And it's a rich topic that deserves a lot of attention and a lot of digging into, and it's going to take a while to, I think, change people's mindsets.
I think it will too. I think it's new. I, decided that it's time to start talking about this. I understand it's controversial. There'll be people that'll be leaving horrible comments, I know. But at this point, I think women need to know the truth. And if you're curious about menopause prevention, or if it's right for you, or if you'd be a good candidate for it, then go to advancedhormonebalancing.com and book a complimentary consultation. Let's see if you're a good candidate, because life is much different when you're hormonally sound than when you're hormonally deficient. And we don't have to tolerate being a Karen, in the later parts of our years, or actually ever. So yeah, it is controversial, but at this point I don't care. And I think every woman should be angry that we've been sold a bill of goods. And if there is something, I enjoy answering these questions, because women, they just don't know where to go. And so if there's something that you would like us to talk about on this podcast, let us know. And like Maggie said, we're going to answer a handful of these questions at the end of every show. And leave a comment, or, let us know what you think. And subscribe to the show so you never miss one, because you don't want to miss the 4 generations of HRT, or how to find a good hormone doctor, because these things are really life-changing. And subscribe to our channel and share, because everybody benefits when your hormones are balanced.